Hi, and welcome to first ever episode of Aanvii Hearing TV. Today we welcome the presence of Dr. Anirudh Purswani, who is with us and who has joined the fight against COVID-19 in Mumbai. So, Doctor, tell us something about yourself.
Good evening, and thank you, Chatin bhai. Thank you for inviting me on your show, and thank you for inviting me on the first ever episode of this channel. I have been associated with you and your organization through various means. I know you as a friend, a patient, a tracker, lot of things. So technically, I joined this fight a few weeks back when we decided that homeopathy has a role to play in this. क्या हुआ is that केरला में, दिल्ली में, नॉर्थ ईस्ट में, जनवरी में notifications आए थे that homeopathy can be used, and because our doctors outside, our government setups are under so much of strain, the amount of strain that they have is enormous. We as general practitioners, we as homeopaths, we have to see to it that we are catering to our patients. अगर हम लोग क्लिनिक बंद करके घर पे बैठ गए तो प्रॉब्लम हो जाएगी, क्योंकि पेशेंट्स जो है फिर गवर्नमेंट हॉस्पिटल भागेंगे. अगर हम लोग अवेलेबल नहीं है तो वो गवर्नमेंट हॉस्पिटल भागेंगे. इसलिए ये नेसेसरी था कि हम लोग अवेलेबल रहे, either through video or through audio or through Skype, through Zoom call, Meet call, okay, so that वो उनके fears, उनके problems हम allay करें. क्या हो रहा था रिसेंट पास्ट में कि क्योंकि कोरोना का इतना खौफ था, इतना फेयर, इतना भय था, हर सेकंड पेशेंट जिसको कोई भी माइनर सोर थ्रोट था ऐसा लग रहा था कि उनको भी कोरोना है, राइट. सो वो एक मिसकंसेप्शन ही नहीं, एक इनकी एंजाइटी बढ़ जाती है कि एग्जैक्टली क्या हो रहा है, ये प्रॉब्लम क्यों हो रहा है. सो दैट इज वेयर वी वर कमिंग इन द पिक्चर एंड वी वर टेलिंग देम कि देयर वाज नथिंग टू पैनिक अबाउट. अगर ये सिम्पटम्स नहीं है तो आपको मोस्टली कोरोना नहीं है. यू टेक योर रेगुलर लाइन ऑफ ट्रीटमेंट, whether homeopathic, whether allopathic, whatever you are taking, and you'll be fine.
So, the good doctor, along with his team, was on the front line to donate I hope I am spelling it right.
Arsenic album 30 is this was the remedy suggested by the Ayush Ministry. The notification had come out around January only.
He has been distributing along with his team to Mumbai police, vegetable vendors, BMC workers, Zomato employees, gas station workers, gas cylinder delivery people, CRPF staff, and other frontline employees and frontline workers who are most vulnerable with the COVID. So great doctor. Could you tell us more something about your team?
So I don't have a team. I am technically a one-man show with my one assistant in my Shivaji Park clinic, one assistant in my Varsova clinic, and one assistant at my Salvation Church Center, which is technically Vichra. So मैंने ये mentally decide करके रखा था, and I had thought that once the official notification comes from the BMC that we can give arsenic album, I will distribute it to as many people who need it on the essential front as possible. मैंने इसलिए क्या किया कि जो important topics थे उनको पहले identify किया. Like मेरे पेशेंट्स वर्ली में है, मेरे कुछ फ्रेंड्स वर्ली में है, मेरे फ्रेंड्स अंधेरी वर्सोवा पे है, मेरा एक फ्रेंड है जो खुद सोशल वॉलंटियरिंग करता है. मैंने उनको आइडेंटिफाई करके उनको पूछा कि विल यू बी रेडी टू गिव दिस मेडिसिन टू पीपल इफ आई गिव इट टू यू. दे सेड कि वी बी मोर देन हैप्पी अगर आप दे रहे हैं, क्योंकि आप नेक काम कर रहे हैं. इस तरीके से हमने टीम्स बनाई. टीम्स टेक्निकली क्या था कि मेरे एंड से मेरा कॉन्टैक्ट पॉइंट एक ही इंसान को था. I have not gone out and given one single dose of arsenic album to anybody personally. Right. क्योंकि मैंने ये डिसाइड किया था कि मैं खुद बाहर नहीं जाऊंगा, नहीं तो मैं इन्फेक्ट हो जाऊंगा, हमें इन्फेक्ट होने के चांसेस बहुत ज़्यादा है. So मैंने एक इंसान को चुना जो जाके आगे जाके अपनी टीम को बांटेगा, so that they are able to cover. इस तरह से हमने वर्सोवा कवर किया, सेवन बंगलोज कवर किया, लोखंडवाला कवर किया, 4 बंगलोज कवर किया, अंधेरी स्टेशन का एरिया कवर किया, अंधेरी ईस्ट कवर किया. We were able to cover Juhu. I was able to cover a big pocket in Kalina, Santa Cruz to one patient. मेरे एक मित्र है जो जेजे हॉस्पिटल में टेक्नीशियन है, उनके थ्रू जेजे हॉस्पिटल में डोजेस पहुंचे. हमारे एक और मित्र है जिन्होंने कोलाबा के एरिया में डोजेस पहुंचे. मेरे काफी पेशेंट्स हैं जिन्होंने वर्ली के अलग अलग एरियाज में ये डोजेस पहुंचाए हैं. वर्ली सीपेस का एरिया हुआ, बीडीडी चौल का एरिया हुआ, सेंचुरी बाजार का एरिया हुआ, वर्ली कोलीवाड़ा जो बहुत ज़्यादा इफेक्टिव था वहाँ वहाँ पे डोजेस गए हैं। सो एक और मेरी पेशेंट थी जिसने शिवाजी पार्क में डिस्ट्रीब्यूशन किया था। सो उस तरीके से हमने क्या किया कि जो नीडी है, जो ऑन द रोड एम्प्लॉइज है, हमने टेक्निकली उनको टारगेट किया इन आवर ओन स्मॉल वे। जो एज यू राइटली सेड पुलिस कर्मी है हमारे, बीएमसी के वर्कर्स हैं हमारे। सो माय प्राइम टारगेट वाज ओनली द एसेंशियल वर्कर्स एंड द एसेंशियल सर्विस वर्कर्स। सो लकीली विद द ब्लेसिंग्स ऑफ गुड पीपल अराउंड मी, आई वाज एबल टू कंप्लीट दिस टास्क। वी आर स्टिल ट्राइंग टू फिगर इट आउट, क्योंकि क्या है अभी हाइप इतनी बढ़ गई है, सो इट इज अ लिटिल प्रॉब्लमेटिक, बट वी आर ट्राइंग टू फिगर आउट मोर वेज एंड मीन्स एज टू व्हाट वी कैन डू। लेकिन अभी तक I can very happily say that we have dispensed thousands of doses, and I'm sure wherever they have reached, thousands of people have benefited.
Great. That's very noble of you, doctor. So, how was your team's experience on the ground, actually?
They were on the contrary very enthusiastic, क्योंकि उनको भी लगा कि they are giving something back to the society and they are doing their own bit. So सबसे मुझे रिपोर्ट्स बहुत अच्छी आई थी, पीपल वो विलिंग टू टेक इट। मैं एक चीज़ मानता हूँ कि अगर मैं दवाई दे रहा हूँ तो मेरा सर्टिफिकेशन दवाई के साथ होगा, इसलिए हर सेट ऑफ दवाइयों के साथ मेरा पेपर वर्क बहुत क्लियर था, क्योंकि करंट सिनेरियो में क्या हो रहा है, देयर इज अ लॉट ऑफ डिस्पेंसिंग व्हिच इज गोइंग ऑन विदाउट पेपर वर्क। सो ये बहुत अनिवार्य है, इट इज़ वेरी एसेंशियल, एंड जजिंग बाय थ्रू योर चैनल आई लाइक टू पुट इट आउट कि इफ यू आर टेकिंग आर्सेनिक एल्बम, सी टू इट दैट योर सोर्स इज रेप्यूटेड। यानी कि इवन अभी जो अगर मैंने बॉटल्स दिए हैं, वो बॉटल्स के साथ मेरा प्रिस्क्रिप्शन आता है, आई एम अ सर्टिफाइड होम्योपैथ। सी टू इट कि आप या तो सर्टिफाइड एक होम्योपैथिक केमिस्ट के पास से दवाइयाँ लें, या तो एक सर्टिफाइड होम्योपैथ है उसी से दवाई लें। क्योंकि क्या हो रहा है कि ग्रोसरी स्टोर्स पे, बेकरीज पे वो लोग ये दवाइयाँ बेच रहे हैं, जबकि उनको लाइसेंस तक नहीं है ये दवाइयाँ रखने। आई मेक दिस पॉइंट वेरी रिस्पॉन्सिबली। एंड क्या हो रहा है टेक्निकली, क्योंकि समवेयर और दी अदर एटीट्यूड ये बार्गेनिंग की तरफ आया है। सो क्योंकि ग्रोसरी वाले को मालूम भी नहीं इसका मतलब क्या है, राइट, इसलिए वो एक छोटी रकम के लिए दे रहा है, क्योंकि उससे खुद खाली प्रॉफिट बनाना है, उसको लगता है कि शक्कर की गोलियां है ले लेंगे। इसके कारण होम्योपैथी इज गेटिंग अ बैड, राइट। सो वी आर फेसिंग दिस प्रॉब्लम आल्सो, दैट इज व्हाई थ्रू योर मीडियम आई वुड लाइक टू रिक्वेस्ट एवरीबॉडी दैट see to it you buy your arsenic album quickly or whatever other medicine you're taking, okay, through a registered homeopath or through a registered homeopathic pharmacy, or see to it that you ask for a certification कि बाबा इस पे लिखा है क्या डोज, प्रिस्क्रिप्शन है क्या। अगर प्रिस्क्रिप्शन नहीं है प्लीज एक्सेप्ट मत कीजिए। मैंने बहुत सारे कोऑपरेटिव हाउसिंग सोसाइटीज को भी दिए हैं दवाई, लेकिन मेरा प्रिस्क्रिप्शन साथ में जाता है। So that is one thing I'd like people to keep a note of,
Yeah. So basically, this will keep the people safe also, and there won't be any malpractices regarding homeopathy medicine.
Absolutely right. Not only malpractices. क्या होता है today you have a kind of trust on me. My patient has a kind of trust on me. I will not ट्रांसफर ओवर दैट ट्रस्ट। अगर मेरे पास है तो मैं दूंगा, मेरे पास नहीं है मैं फ्रैंकली बोलूंगा कि ये नहीं है मेरे पास, राइट। लेकिन यू डोंट नो व्हाट द फार्मेसी गाय इज गिविंग, सो दैट इज वेयर द प्रॉब्लम इज आल्सो कमिंग, सो दैट इज वन थिंग व्हिच इज देयर। अनदर प्रॉब्लम व्हिच वी डिड फेस इज अ लॉट ऑफ पीपल वर इनिशियली हेजिटेंट, ये क्या दवाई है, कौन बोला, कैसे बोला। इसलिए हमने आयुष के जो नोटिस थे, मेरे हर वॉलंटियर के पास आयुष के नोटिस की एक कॉपी थी, और जो बीएमसी का सर्कुलर इशू हुआ था आई थिंक कुछ 3 या 4 हफ्ते पहले, 3 हफ्ते पहले आई थिंक, उसकी भी एक कॉपी थी, ये दिखाने के लिए कि ये आयुष ने रेकमेंड किया है एंड बीएमसी ने रेकमेंड।
So the next question is, how did you motivate yourself to take on this huge undertaking to distribute the medicine?
It's all about wanting to give back to society. I have always been a staunch homeopath all my life. I come from a family of doctors जहाँ पे my father, my uncle, my grandfather, my great grandfather were all doctors. So क्या था, मुझे ये मालूम था कि यहाँ पे दवाइयाँ काम करती है। मैंने हर बीमारी का इलाज टू द बेस्ट पॉसिबल ट्राई किया है यूजिंग साइंटिफिक होम्योपैथी। ओके, रिजल्ट बेस्ड होम्योपैथी। तो यहाँ पे भी हमें मालूम था कि ऐसे कुछ हो रहा है, लेकिन मैं तब तक रुका था जब तक कि ऑफिशियल नोटिफिकेशन ना आ जाए मेरे खुद के अथॉरिटीज से, राइट।
Okay.
सो क्या होता है, अगर ऑफिशियल नोटिफिकेशन आ गई है मतलब उसने कुछ काम किया है। एंड मैं खुद कोविड को फ्रॉम पर्सनल पॉइंट ऑफ व्यू जनवरी फरवरी से ट्रैक कर रहा था कि क्या एग्जैक्टली है बीमारी, जब से केरला में केस हुआ था। एंड केरला में जो मॉड्यूल यूज किया गया था, केरला में होम्योपैथिक आर्सेनिक एल्बम 30 also was given on a very large scale by the government. So that was used which I had kept in mind. Okay, and a lot of people had kept in mind क्योंकि वो openly government support को दे रही थी। And Kerala का जो outcome था has been way better compared to the other states as is visible, you know. So that is what kept me motivated कि जब भी notification आएगा, as many people who need it, I will give it free of cost. And by God's grace, we've given all those who deserve it free of cost.
Great. While your team was deployed on the front line, so what precautions and what preventive measures did they take to make themselves safe from the pandemic?
Extremely good question. I always saw to it that all my volunteers, point number one, have got their masks on in place. All my volunteers, all my patients who were taking it, for that matter, I saw to it that all of them are wearing a mask. मैंने जानबूझ के फोटोज इसलिए मंगाए थे सोशल मीडिया पे डालने के लिए, लेकिन ताकि ये डालने के लिए कि देखने के लिए कि पेशेंट ने मास्क पहना है या नहीं पहना है। All my patients saw to it that all measures were put into place properly. Okay, that is the very reason why separate doses were given to avoid minimum contact. So all those precautions were taking place. My patients themselves were on doses who were giving these medicines, so that they themselves are taken care of. So we were keeping regular tabs of who is doing what, so that we know what exactly is what. Apart from that, I saw to it that only one area is targeted at a time. I did not dispense randomly to everybody. एक area लिया, उसको target किया, वहाँ से क्या रिक्वायरमेंट आगे आई, अगर हमारे पास और थे तो हमने और दिए। एक वर्सोवा के एक एरिया से एक वॉलंटियर थे मेरे, वो उन्होंने गुरुद्वारा से बांटना चालू किया क्योंकि वहाँ पे लंगर के लिए लोग आते हैं, those who are homeless, they come for the evening लंगर, so वहाँ पे we started giving, so वहाँ से थोड़ी और रिक्वायरमेंट आई, so we gave more, as many as we could we gave to in my personal capacity. So we saw to it that we were taking care of only one area at a time, so that we knew how many people are in.
So moving on to our next question, what can you tell us more about RSL30? What are the benefits of the medicine?
So technically, homeopathy works on the principles of like cures like. Okay, it is a system discovered by Dr. Samuel Hahnemann. Okay, who was a physician himself, who was a German physician. Now, arsenic album 30 is one remedy which is used for a multitude of conditions. Okay. It was recommended by the Ayush Ministry. That is why we came to the conclusion that somewhere or the other it is useful for a few. As of now, apart from arsenic album, there are many other remedies being used also. Okay. But one has to always understand one thing, because homeopathy is a natural mode of treatment. Okay. We build up the body's immunity to fight the disease. Okay. So any which ways, all those patients of mine who are on homeopathy, their immunity was already built up, because we are not giving you any medicine to suppress the body or suppress the illness in the body. So similarly, our cell seen was matching to the drug picture of the initial stages of the flu. So that's how they came to it, and based on the results that we had in Kerala and the other states, is what we decided to give it on. I'm sure now is not the time to sit and talk about the practicality of it, which I have already mentioned earlier. It's now time to give it, I guess, and on an individual level, all those people who are giving it, all those people who are using other remedies, are now trying to research and see how the cases respond. Like every homeopath who is taking care of a COVID case, even tertiary, right, is seeing to it that we keep a record so that later on we can analyze and see कितने लोग ठीक हुए, कितने लोग ठीक नहीं हुए. मेरे personal capacity में काफी लोग हैं who are also on the antibiotic and the allopathic line of treatment. Along with that, they are taking arsenic album cutting. So we are keeping a record. I have some patients who are only taking arsenic album cutting. So we are all maintaining a record, and those records eventually will be compiled. A lot of people are doing research on a very bigger scale. So that will be compiled, and from there we can go back and read the efficacy and understand the efficacy at a later date.
Okay. So, what are the side effects of this medication?
Now, point number one. Homeopathy doesn't have side effects is something which I will not agree with. Okay, 99% of the cases may not have side effects. I totally agree.
Okay.
But sometimes you may have one or two patients who are overtly sensitive. We have all gone through such cases where you may have one patient who may have had a reaction. वो बोलते हैं एक कहावत है कि वो पहले जो है बीमारी को बढ़ाता है फिर कम करता है. तो वो चक्कर में क्या हो जाता है, कभी कभार कुछ लोग ज्यादा सेंसिटिव होते हैं तो उनको रिएक्शन आ जाता है. जो लोग ज्यादा ओवरली सेंसिटिव है उनको भी रिएक्शन आता है. लाइक इफ आई गिव यू अ फाइन एग्जांपल, कुछ लोग इतने सेंसिटिव है अगर उन्होंने एक क्रोसिन खा लिया तो उनको रैश आता है. राइट. सिमिलरली अगर होम्योपैथिक मेडिसिन का भी लोएस्ट पे लोएस्ट पावर दिया तो उनको रिएक्शन. सो दैट वे एवरी पर्सन डज हैव अ रिएक्शन, can have a reaction. But overall, homeopathy is a very safe mode of medication. It does not have any major side effects if it is prescribed correctly.
Okay.
If it is prescribed wrongly, many a times a reversible disease can become irreversible.
Okay.
So you have to be careful about that.
Okay. Do we need a prescription or for how much dosage should we take, or should we start what is prescribed by Ayush?
As a general measures, we are all taking what Ayush has prescribed. Okay. Ayush has given a general guideline which is perfectly fine. Now, some cases are responding to it, some cases are not responding to it. In some areas, we have increased the amount of dosage. If you are more prone to the illness or you are in a hotspot area, we may increase the dose as per what we may feel. But that is done by a supervised homeopath. Like for example, my patient in Worli or my people in Worli who are taking arsenic alcohol, because Worli is a hotspot. Okay, I have made them take it every day for 5 to 7 days continuous. For my patients who are not in a hotspot, they can take the Ayush dose, which says 4 pills to be taken in the morning on empty stomach for 4 days. Okay, so they can take that kind of dose. So we are regulating doses.
But if in case our viewers would like to reach you, how can they reach you?
Your viewers are most welcome to reach me. They can reach me onto my telephone number and my email ID, which I will certainly share with you. I am always available, okay, on those. I will not really be comfortable sorting out too many doubts on WhatsApp because I go mad typing, but I will certainly be available on the phone. For any homeopathy related queries, I will certainly be available, and I will always give my best opinion and I have a truthful opinion. Right. So I will share my telephone number with you, which you can put down for sure, and my email ID, which you can take down for sure, and they can certainly get to me. I'm also available at both my clinics. As of now, my Andheri clinic has been, we are working on it because as much as I can go down there, because Andheri is more of a hotspot. I stay at Dadar.
Yeah.
So I have one clinic at Versova, Andheri. I have one clinic at Shivaji Park. I'm also attached to the Salvation Church Medical Center, which is also known as the Portuguese Church at Dadar. But that OPD has been shut for the last 2.5 months owing to the lockdown, and because it's a polyclinic, we've not really been working. Yeah. So I am spread around Mumbai, but as of now, I'm trying to work as best as I can. So I'll share my contact details with you. You can share it with the people there.
Sure, Dr. Anirudh. Thank you for being here. Thank you for taking this.
Thank you, Jatin bhai. I really appreciate the effort. Keep the hard work going, and hopefully we should fight this illness and then, turn out victorious. Right? Thank you very much.
Yeah.